So I'm glad that you brought out the telemedicine guidelines. So Tele ICU being so new, I'm sure there are no set guidelines for this. But I think you do follow Tele ICU in your setup.
Right.
So if you could tell us some of the SOPs that you follow in your setup.
Sure. See, I think the SOPs or standard operating procedures are very important in something like this, because a lot of times you're communicating with people who have not experienced Tele ICU before or any kind of intensive care. And the number one SOP is communication. And the key is communication, because you also have to understand that the remote site may not have all the available resources that you do. They may not have the lab resources, they may not have the imaging resources, they may not have a CT scanner, and they may not even have the doctors, the subspecialists. So we can solve a lot of those. For example, the subspecialist problem, we have access to the entire, say, Apollo EICU, for example. We have the entire range of subspecialists we can access to within minutes if we need to, and we can put them in touch, and we are doing that. In fact, we wrote an article on the neurology aspect of it, and it recently got published. So we have shown that you can actually do a pretty good job at getting subspecialty care to even places which don't have it. In addition to that, we've also seen a situation where if you can have protocols, for example, you have myocardial infarction, you have a set protocol in terms of how to manage these patients, and most patients can be managed very similar way. We can actually teach the remote site to go through that protocol and also follow the standard operating procedure for somebody. When do you get an EKG? When do you actually initiate thrombolysis? Once you get thrombolysis, what do you do? How often do you check the pulse? Do you look for a hematoma? When do you check a CBC after that? So we have these kinds of SOPs for the clinical part of it. We also have SOPs for running the process, which means check the connectivity, make sure that the remote site, the audio is working, the video is working. So there's a whole, like a checklist that we go to, just like taking off a plane, you go through a checklist. We have a very similar infrastructure.
So it's something like Atul Gavande's with checklist manifesto.
Exactly. So I think, these things actually save, because the human brain is only so smart. It's not, you can't remember everything. So having a checklist and making sure that you're actually doing that does save lives.